part 2 of Preparing to Pass Advanced Pharmacology. Respiratory medicines. I was making these notes. I want you to pay attention to these things when you're looking at the chapter. And if you want to be successful in nursing school, I know it sucks, but you got to look at the chapter. Bronchodilators. What do? They dilate the airway of the respiratory tree, making air exchange and respirations easier for the client and relax smooth muscle in the bronchi. These drugs are used to treat. You see those commas? I want your butt puckering every time you see a sentence got all them commas. Think and select all that apply. You got to prepare for them. I'd get a 3x5 index cards and I'd say these drugs, what drugs? Bronchodilators are used to treat, and then I'd count them up. 1, 2, 3, 4, 5. I'd put 5 and I'd list them on the other side. And then I'd move on with the rest of my notes or whatever I was doing. But bronchodilators are used to treat which of the following? Select all that apply. I'd be able to list them on a blank sheet of paper. COPD is a disease state characterized by pulmonary airflow obstruction. It's usually progressive, not fully reversible, and sometimes accompanied by airway hyperactivity. Airflow obstruction may be a result of chronic bronchitis or emphysema, and chronic hypercapnia, that's high CO2. The stimulus to breathe is low PO2 instead of increased PCO2. For us, just every Joe Schmo, Tom, Dick, Harry, and Sal on the planet, our drive to take another breath is when we get excess CO2 because the tissues are making that and it's building up. But for somebody with COPD, they've been living in a world of high CO2. So their body had to adjust itself, and their stimulus to breathe is low O2. That's why you don't give somebody with COPD more than 2 liters of O2, because it'll kill his drive to breathe. Emphysema is an abnormal permanent enlargement of airspace distal to the terminal bronchioles, involving destruction of the alveolar wall without obvious fibrosis. So look, and then bronchodilators nursing considerations. This is what they expect you to know. They expect you to know to do this. They expect you to know to teach this. And so if you want to be successful, pay attention to the nursing considerations. A lot of times you'll read through and they'll have signs and symptoms, and the signs and symptoms may be different. The signs and symptoms will be the same for most of them, so you're looking for what is different. Anyway, bronchodilators are contraindicated in who? What about the medicine is going to make you get up out your chair and stop it? You got to know that. Contraindicated in people with peptic ulcer disease. You see them commas? I know your butt is puckered. Just to the nth degree of pucker. Peptic ulcer disease, severe cardiac disease, and cardiac dysrhythmias. We're not giving them bronchodilators. Hyperthyroidism, because they already nervous as a cat. Or uncontrolled seizure disorders. Who's not getting it? These aren't. Which of the following are bronchodilators contraindicated in? Administer oral medications after meals to decrease GI. You got to know to teach that. Either in discharge teaching or Homer done call complaining because his GI is irritated. And so we're going to tell him, well, take your med after meal, Mr. Homer. I told you that, but you didn't have your hearing aids in. Anyway, IV but that's the whole reason of giving them something in print with the discharge instructions. IV preparation should be administered slowly by a registered nurse, always by an infusion pump. IV administration of what? Bronchodilators. You hear me? Slow it down, Ethel. The nurse should monitor the client closely for adverse effects. This is crap that we don't want it to happen. Not on our watch. Restlessness. If you see restlessness, I want you thinking low O2. Blood pucker, low O2, restlessness. Tremors, palpitations, tachycardia, dysrhythmias, anorexia, nausea and vomiting. It's not anorexia, oh, I'm fat. It's anorexia, no, I just don't feel like eating. Because nausea and vomiting's coming after that, you know. If such effects occur, what effects? These up here. The medication is stopped. That's going to make me get up out my chair. So, reasons to discontinue it. 1, 2, 3, 4, 5, 6, 7, 8. I'd put an 8 underneath and list them and be able to put them on a blank sheet of paper. The nurse must monitor the serum theophylline level. What's the normal? When they give you a normal, commit it to memory. Just, you know, you're grown. You want to be a nurse. Commit it to memory. Okay. And look, a level greater than that indicates toxicity. Yeah, I would know that. In this case, what are you going to do? I'm going to stop it. So if it tells me to, I'd be prepared for a therapeutic theophylline value that's out of whack. And I have to know that I'm going to stop it first and then call the doctor. Mouth dryness and throat irritation may occur with inhaled bronchodilators. You know those okay. Tolerance and paradoxical, that means we don't know how it started. Bronchoconstriction are also possible. Instruct the client. This is what they expect you to know to teach them. How to use an inhaler, a nebulizer, and how to monitor the amount of medication remaining in it, the canister. You got to show them where the little number is and stuff. Instruct the client to avoid products. Yeah, don't be drinking this. They expect you to know to tell them. Coffee, tea, cola, chocolate, anything containing caffeine, because theophylline going to have them nervous as a cat. Instruct them on how to monitor their pulse. And I would have them do it for me. They'd have to pass, or either they would fail that checkoff and have to come back. Instruct the client with diabetes. They specific, of all the things they could have said, they said diabetes. Instruct them to monitor the blood glucose. Why? Because bronchodilators can increase their blood glucose. Yeah. So a nurse monitoring a client who is receiving intravenous theophylline checks the patient's the client's most recent blood theophylline level. Which value would the nurse interpret as within the normal range? You remember? Okay. Pause it. Pause it. You got your final answer? Yeah, it's C. Well, it should have said C. I'm going to put C. Yeah, because I can. The therapeutic value of theophylline, did you remember? Maybe that'll spark you to remember now. If the level is below it, then we're going to have to increase the rate. But if the level is greater than it, it indicates toxicity. And look, the teaching strategy, knowledge of the subject therapeutic theophylline level would be required, is needed. So if you didn't know it, put it, that's frontal lobe material. Recall that a therapeutic level is 10 to 20, and that'll direct you to the correct option. You see how, I hope this helped you, just in how to look at it. Y'all be good.